I'd like to go to Vicki Schlensky.
Okay, so I'd like to introduce Dr. Mark Kellen. Dr. Kellen is a staff anesthesiologist here in Rockford. He attended the University of Chicago for medical school and completed his residency at the University of Iowa. He was also a major in the United States Air Force. Dr. Kellen is a former president of the Winnebago County Medical Society. He is a delegate to the Illinois State Medical Society House of Delegates and is the current president of the Association of American Physicians and Surgeons. Dr. Kellen.
Thanks everyone for coming tonight. This will be very short. I only really have one thing to say. I'm going to be the only one saying this. We do not need health care reform. No one else will say that. But what we really need is government reform. Because virtually every problem we have with cost and access for the majority of the people is due to government rules and regulations that prevent you from seeking out the best option for your own individual circumstances. We're frequently faced with this thing about, oh, we're the only developed nation without this socialized medicine system, this government-run system. Well, they're always talking about these European nations, so let's talk about them. Maybe it's Germany they want to emulate. Or that would be, well, here'd be the Germany, massive strikes across the country as physicians. Or maybe Spain. Spain, yeah, it must be Spain. I can't get papers for it. Spanish physicians strike for more time with patients. I can't understand why the government didn't solve it. Europe was supposed to be the utopia. Must be France. Yes, remember, World Health Organization rankings, France, number one. Number one in the world. It's got to be good there. French physicians are burned out. Well, if it's not France, it's Belgium. No, Belgium, doctors take to the streets. Bottom line, we do not need health care reform. We need government reform. I'll pay $20 to anyone that can show me any aspect of HR 3200 that I cannot tell you why it's a bad idea. Okay? Thanks.
I'd like to introduce Vince Keenan. He is the Executive Vice President of the Illinois Academy of Family Physicians, which is a state chapter of the American Academy of Family Physicians. The IAFP's 3,800 members are the Professional Medical Society for Illinois Family Physicians. Mr. Keenan has worked at the IAFP for 20 years. He previously worked for the American Medical Association and at the American Academy of Pediatrics. He has a Master's of Science in Public Health from the University of Illinois Chicago and a Bachelor's of Education from Northwestern University. He and his 7 staff colleagues at IAFP provide government relations, public relations, CME, and other member services. Vince Keenan.
Thank you. I'm so glad to see all of you out here tonight. I think your future is what we're talking about here with the healthcare reform discussions that are going on in Washington. And I agree with Dr. Keller. We need to hear from you what your questions are, because with a 1,000-page HR 3200 and with a 240-page bill that Senator Baucus introduced, we We also support a public option that will bring stability and fair play standards to the system. Meanwhile, people should be able to keep the coverage they have. For too many in our nation, right now the only option is no option, and that's not the American way. Healthcare reform must ensure that everyone has access to a primary care physician. Right now, we have a growing shortage of primary care physicians. The reform system we envision must pay primary care physicians for all the work if we want medical students to choose careers as primary care physicians. When the medical students are facing $200,000 in medical school loans, it's hard to choose family medicine if you make 2 to 3 times that salary in a subspecialty and get out of debt much sooner than later. There are many areas in Illinois and nationwide where primary care doctors are needed now. We need our lawmakers to support training the world's best doctors. We must attract the right caring physicians and prepare them to care for the needs of our growing and changing nation. We must guarantee our children and grandchildren that they will have a primary care doctor for their families. Any legislation passed now will take years to truly make an impact. Someone who was a second medical students is still probably 6 or more years away from practicing medicine. We absolutely must build an American solution that controls the skyrocketing preventable health care costs, a solution that gives our patients peace of mind with a primary care physician as partner in their health care. We do support President Obama's position that Congress must pass a strong health care bill reform this year. We don't think our doctors or our patients can wait any longer.
I'd like to introduce Dr. Arvind Goyal. Dr. Goyal currently serves as the Chief Medical Officer and Medical Director of Lynn Community Care, a federally qualified health center. He's board certified in family medicine, preventive medicine, and public health, and geriatrics. He obtained a master's degree in public health from the University of Illinois. He's previously elected positions include Chair of the Illinois Medical Licensing Board, President of the Illinois State Medical Society, President and Board Chair of the Chicago Medical Society, and President of the American Association of Public Health Physicians. Dr. Goyal.
Good evening. Anybody here who's happy with medical insurance coverage or the ability to get medical care conveniently, safely, with a high quality from a physician of your choice, at a location of your choice, at a cost that you think is affordable? I'd like to see your hands. Very good. That's very good. Let me just tell you a small story. The story is about this gentleman, a business-looking person who got in a hurry in a cab and gave the cabbie the address he wanted to go to, and sounded in a hurry. The cab driver took off like a dart, and the person in the backseat, the passenger, was going from one door to the other, top, bottom, and finally he says, "Sir, I'm really scared. Could you please be a little bit careful? I've got 10 children at home and I worry." The cabbie turned his face. He said, "You've got 10 children at home. You want me to be careful?" What that means is that they both had a different perspective. They both agreed that he needed to get where he wanted to get. He needed to get there in a hurry, but they had a different perspective. The cab driver was trying to help him get on time wherever he was going. And we have a slight difference in perspectives at this time on this issue. However,